Hey guys, welcome back to the Proactive Lifestyle Series. We've been talking a lot about posture and breathing patterns when it comes to neck and shoulder pain. Today what I want to talk about is a little more on headaches and migraines. We see headaches and migraines are one of the top things we see here in the office. Actually probably one of my favorite things to treat because usually it's so simple. Not always do we get great results, but most of the time somebody walks in with a headache, they're going to leave without one, or it's going to be drastically reduced. And most of the time with that concept, we show them what we've already been showing you guys is, we adjust them, we do certain exercises, we show them the posture, we show them the breathing, and that allows the headaches to kind of stay away. Okay, so you'll see kind of this vicious cycle with headaches. They always want to come back. Why? Because they're usually tension style. Tension style, which means they're coming from muscle, they're coming from trigger points, and it's usually coming from the way the head's sitting, the way the shoulders are, us being at a computer all the time. I mean, that stuff makes a huge impact on the muscle tone in the neck and the shoulders, which then gives you the tension style headaches. What we also see a lot of is TMJ problems, some tightness in the jaw, problems with the bite. That really affects somebody with migraines and headaches. So along, we've already showed you guys, how to correct the posture, how to do the proper breathing. I mean, those are some of the basic things we start working with patients with that have headaches and migraines. We also go after some mid-back things, some upper back extensions, some exercises for that. But what I kind of wanted to show you today a little bit is more stuff that you could do a little bit with as far as stretching. We all think about stretching our legs or stretching different muscles, but we never really think about stretching the jaw. So when we look at people with headaches and migraines, one of the biggest things that I'll see is we'll do something called a bite test, where we kind of test to see how much tension they have here. So we do the bite test on them, and a lot of times somebody with a migraine or a headache will be off. They won't be able to bite down on one side or the other when we do the test because there's so much tightness in the jaw. And it's pretty simple to try to alleviate that a little bit. Some people find it hard to do on themselves because it can be a little painful. But there's basically about 3 exercises that I would really recommend to try. If you've been, especially if you've been adjusted before, or you've been to physical therapy for headaches, and they seem to just not want to go away, well, has anybody ever looked at your jaw? That's a big thing. Have the jaw looked at, because that can make a big difference. But what I want to discuss here, like I said, is just the 3 simple things you can do. So when we're looking at this, a lot of times what people notice is that they'll either clench or grind at night. They'll have some clicking in the jaw. Honestly, sometimes they're asymptomatic. They don't even know that they have an issue. Then we do the bite test and they're like, oh, wow, that's really sore and really tight. So one way to work on that after we test is these stretches. So first stretch is basically, they're all real simple. The first one is just, you're opening the mouth as wide as you can, and all you're doing is you're kind of assisting. You're pulling just a little bit extra. You don't want to pull too hard. You want to pull just enough to where you feel the stretch happen up by the ear. This is kind of where the joint is. So when you pull, you should feel the pull here in the jaw, sometimes a little bit in the temple. So the first one I do is just kind of stabilize the head a little bit. We open the mouth, and we just pull just a little bit extra. You just pull and hold. So you do that 3 or 4 times, holding it for maybe 4 or 5 seconds, just trying to get that pressure in the jaw. Then what we do is we go to a side-to-side stretch. So instead of opening it all the way, we just open our mouth a little bit. And what we do, again, I'm going to kind of stabilize here. I'm going to push the bottom of my jaw to the left. Not a whole lot of pressure, just enough to where I feel the stretch in the jaw. And when I push to the left, that's where it's going to be. You're going to feel that pressure on the left side as you go to that left side. Same concept, do that a few times. Then we come to the other side, and we're going to push on the jaw that way. You can do a few cycles of this, but just trying to loosen up that jaw can make a huge difference on your headaches and migraines. A lot of times, especially if you have, say you're having a migraine right away, a lot of times you'll notice just by moving your jaw, it can reduce it or increase the symptoms. So try these stretches out. So hopefully, for some of you, this will help. I know, again, it's uncomfortable, it's a little awkward, but you can try it yourself, or if not, have a professional try it. They could probably really help you if you're suffering from headaches and migraines. TMJ needs to be addressed. So take a look at that, try it out, and see how it goes. Thanks.